If you have fibroids and all the symptoms that come along with them, you're probably considering a hysterectomy. But wait, there's a better procedure that does not mean the downtime, and one procedure you can actually go through the wrist and you go home the same day. Joining us with details on that, Dr. Eric Hardee with Houston Fibroids and Dr. William Fox with Houston Fibroids as well. All right, this is good news for so many people. The guest we just had, when she heard me talk about fibroids, she goes, "What?" She goes, "I have this problem." A lot of women do, and explain what happens in the body and why it causes all those problems.
So fibroids are extremely common. Up to 40% of women by the age of 40 will have fibroids, and actually up to 80% of African American women will have them in their lifetime. And fibroids are benign tumor, meaning non-cancerous. It forms within the uterus, and the problem is that they can cause lots of symptoms. Really abnormal, heavy periods, lots of pain, lots of abdominal bloating. They can cause pressure on the surrounding organs, on the bladder, on the colon, cause constipation, need to go to the restroom frequently. And
basically, really, what you just said is that you're miserable.
Exactly. Yes, very uncomfortable. And women, suffer for a long time, and then they're told their options are, hysterectomy, which is an open surgical procedure that requires, quite a bit of downtime and be done in the hospital. Or there's some less invasive options, but all of those, have potential downsides to them as well.
Yeah. Can we start with things that are a little less aggressive than surgery? Like, could it be a hormonal problem, things like that? Do y'all kind of start slow?
Well, usually patients have seen their physician a few times, and they start with medical management, either birth control pills, some try an IUD, other medications, injectable medications like Lupron can work for some ladies. But in most patients, it doesn't work long term, and they seek out other options, and that's what leads them to possibly having surgery or other.
Yeah, there are a lot of folks who are putting it off, a lot of women who are putting it off because they saw their mother or somebody else go through it. And an actual hysterectomy does have some downtime to it. It's major surgery and you're yanking out body parts.
Hysterectomy is a great option for ladies. It's a long proven track record, but the downtime with the hysterectomy, typically ladies are out of commission for 6 to 8 weeks even, have a big scar on the abdomen that they may not want.
And if I was saying to you earlier, if I have a big scar, it means I should have a very flat tummy too. So right. Cue the plastic surgeon.
But, a lot of ladies don't want to miss work, don't want to have the downtime, and they even tell me, I don't want to have my body parts removed, I don't want to lose my uterus.
Yeah,
and
so instead of removing that body part, what you do is get more direct on what's causing the issue, and that is, of course, the fibroids themselves. So there's uterine fibroid embolization. Explain what that is.
Right, so embolization means that we're blocking the blood flow. And so what we can do is we can go in through an artery in the wrist, and we put a catheter, which is a small plastic tube about the size of a piece of spaghetti. It goes in through the wrist, and we can then direct that.
In through the wrist?
We go in through the wrist, and we can direct that catheter all the way down into the uterus. And then we put the catheter out directly to the tumors, and we inject tiny little microscopic little beads. And those beads go in and block the blood flow to the tumor, and then the tumor shrinks down and turns into scar tissue.
Yeah, and the recovery time of that is?
Very short. I've been doing this for about 16 years, and the transradial going through the wrist access has actually been one of the biggest game changers. When you go through the wrist, ladies are able to actually get up and walk off the table. They can walk around our recovery suite. They can sit in a chair. Typical angiogram type procedures, they'd have to lay flat for 6 hours, which nobody really likes to do, and the recovery time is much longer. With the wrist access, they can get up and walk around, go home in about 2 hours, and be back at work in 3 or 4 days.
Wow, and once those fibroids are done, they're done. They're not coming back?
Right, after you inject the particles, like Dr. Fox said, the fibroids shrivel up, the symptoms go away, and in most ladies, they don't come back.
All right, the ideal patient is?
Typically age 35 to 55, ladies with fibroids that have symptoms. They have to have symptoms, either abnormal heavy bleeding, pelvic pain or pressure, bulk-related symptoms like urinary frequency, and the patients in that age group have to be through having children. This is not really a procedure that we would offer first line to younger ladies who want to have future pregnancies. Okay,
so that transradial advantage, of course, as we said, the wrist artery access, and it's just the recovery time is great. There really is not much of a recovery time.
Right.
The other thing is a lot of folks would think that if this is a new technology, that everyone who's in this part of medicine would be doing it. Not everyone does this.
It's very highly specialized. Both Dr. Fox and I are vascular interventional radiologists. All we do are minimally invasive procedures with imaging guidance using X-ray or ultrasound to direct small tubes or needles into different body parts and shut down blood supply or open up blood supply.
And I get patients a lot that'll ask me, well, if this is such a great solution, why haven't I heard about it? And I think the thing is the procedure itself has been around since the late 90s, but as in everything in medicine, we're constantly making advances and improvements, and it's really been within the last 5 years that we've got the particles that are sized well enough, the catheters that are small enough, the techniques that are perfected to where we're able to do it as an outpatient with minimal downtime, where patients are able to have the procedure, go home the same day, and have their pain controlled at home and then go back to work. Before, even with this procedure, we tended to keep patients in the hospital for a few days and try to control their pain with the older techniques. And so then the advantage over the other operations weren't as defined. But now, you know, it's the patients come in and say, well, you know, this is the best thing I've ever done.
I know there's been incremental evolvement over the last 16 years, but the pain medication like Dr. Fox spoke about, but also transradial access going through the wrist has been just night and day. People get it done and can walk home.
Yeah. All right. If you're seeking relief from fibroids, you can contact Houston Fibroids at this number right here, 713-575-3686, 713-575-3686, or log on to HoustonFibroids.com for more information. Thank you very much.